Hello, my name is Annette Olison, and I will be presenting today's webinar on bloodborne pathogens. I am a safety and health consultant with the Pennsylvania OSHA Consultation program and have been in the safety and health industry for 30 plus years. Today's webinar will be pre-recorded. Our chat room will be open to submit questions. We will be answering questions through this chat feature. If due to the technical nature of the question and a more thorough response is required, we will post the answer on our website within 7 days of the webinar. This webinar will also be posted on our website for additional viewing if you would like to view it again. An overview of the webinar today. The purpose is to provide attendees with essential need-to-know information about the hazards associated with bloodborne pathogens in general industry. Some topics we will cover is why is this important, what are bloodborne pathogens, who is at risk of exposure, and what steps should you take if you are exposed. What are bloodborne pathogens? These are pathogenic microorganisms present in human blood or other potentially infectious material that can cause diseases. Some primary concerns are hepatitis B, HIV, or the human immunodeficiency virus, and hepatitis C. Hepatitis B has infected over 12 million Americans. That's 1 in 20. 40,000 annually. Symptoms are listed there: jaundice, fatigue, abdominal pain, loss of appetite, intermittent nausea and vomiting, and it may also lead to chronic liver disease or liver cancer and death. You can see the chart there on the right where the incidence of acute hepatitis B from 1980 to 2014 has decreased over the years. This is largely due to a very effective hepatitis B vaccine that we have available to combat contracting the virus. Two significant things about hepatitis B is that it can survive for up to a week in dry blood, and also you don't have to show any symptoms if you are carrying the virus. So there may be individuals in the workforce who are infected and show no symptoms. 10% of the hepatitis B cases are chronic, 2 to 3% of them are fatal, and it is transmitted blood to blood. And as I mentioned before, it does survive in dry blood for up to 7 days. The HIV virus, or the human immune deficiency virus, is the virus that leads to AIDS. It affects the body's immune system. One significant difference between HIV and hepatitis B is that it does not survive well outside the body. There is an estimated greater than 1.1 million people living with HIV, and you are infected for life. Treatment consists of treating the result from the immune deficiency. Is hepatitis B as dangerous as HIV? HIV is a more lethal virus, but hepatitis B is actually more contagious. There is a vaccine available, which I mentioned, which is 90% effective in prevention of the infection, but there is no vaccine for HIV. Hepatitis C is our most common chronic bloodborne infection in the U.S. You can see the symptoms there are very similar to hepatitis B, with jaundice, fatigue, abdominal pain, loss of appetite, and it can also lead to chronic liver disease and death. When we look at the transmission of hepatitis C compared to HIV and hepatitis B, if the transmission rate on hepatitis C is at 2% or 20 in 1,000 will contract the virus. The risk for HIV and hepatitis B are 0.3% or 3 in 1,000 for HIV, and 30% or 300 in 1,000 for hepatitis B. You can see there through those percentages that contracting hepatitis B is at a lot greater percentage than the other two viruses. Studies have shown that hepatitis C may survive on environmental surfaces or room temperature at least 16 hours, but no longer than 4 days. So again, it does, similar to hepatitis B, where it will survive outside the body, but not as long as hepatitis B. So key points to remember: there is no vaccine for hepatitis C. There is no post-exposure prophylaxis treatment that you can obtain. There are 2 drugs licensed for treatment of chronic hepatitis C. The CDC has done testing on these drugs and are still in the process of fully evaluating that. It is estimated that over 4 million people in the United States are infected with hepatitis C, and the only thing we really have to combat the contraction of the virus is use universal precautions and personal protective equipment. Risk of exposure: our contamination sources include blood, other potentially infectious materials, and they include any human body fluids, any unfixed tissue or organ from humans, culture medias, or other solutions, experimental animal blood, tissues, or organs infected with HIV or hepatitis B. How does the exposure occur? Can happen through a needle stick, cut from a sharp, can be contact with mucous membranes via the eyes, nose, mouth. That would be blood or other potentially infectious materials would splash up into these areas. It can be, an exposure can occur through broken skin. Broken skin can be through an open sore, abrasion, cut, acne, or even sunburn or blisters. How do I know who is infected? You don't. Anyone could be infected. The safest way to handle exposure to blood or in the work environment is to utilize what we call universal precautions, and I will discuss them later on. Here we have a list of occupations at risk of an exposure. So we have our first responders, our housekeeping personnel, in some industries, nursing staff, and other healthcare professionals. The CDC estimates 5.6 million workers in the healthcare and related occupations are at risk. Here we have a pie chart of the occupational groups of healthcare personnel and who could be potentially exposed to blood and body fluids. Our greatest percentages are nursing staff, which is at about 44%. Next are physicians at 28%, and then technicians at 15%. These would be potentially laboratory technicians handling blood or other body fluids. The next pie chart shows work locations where blood, body fluid exposures occur. We have our greatest percentage at our inpatient work location at about 40%. Underneath that, you can see that is broken down into our medical surgical wards at 20%, intensive care units at 13%, and it goes down from there. The next one is the operating room areas at 25%. And then our procedure room and emergency rooms are approximately about the same, where we have between 9% for the procedure room and 8% for the emergency room. A significant requirement in the in OSHA's Bloodborne Pathogens standard is the requirement to have an exposure control plan. This plan needs to be written, accessible to employees, reviewed and updated annually, and updated whenever there's a new task or procedure that puts employees at risk. Required elements: a significant component is the exposure determination. This is where you look at the tasks that employees are performing and you list those tasks and the occupational titles within the exposure control plan. Also, you need to include what engineering controls you will be using, work practice controls, personal protective equipment required, information on the hepatitis vaccine, housekeeping schedules and procedures, and the post-exposure procedures. So I mentioned previously that universal precautions should be observed. This is the concept that we treat all blood and body fluids as if they are contaminated. We avoid direct contact with blood and body fluids using proper personal protective equipment. We maintain the PPE in good condition, and we use good personal hygiene. We also have established proper cleanup techniques and proper decontamination techniques. Engineering includes safer medical devices, our sharps containers, and possibly biosafety cabinets, say in a laboratory setting. The safer medical devices have been, as we've developed these and they've become more and more available on the market, we may have a few needles, we may have some needles out there that don't have safer medical devices, but what is required is that employers look at this annually, review this, and determine if there's been something new on the market. And this review needs to be documented with date and what you reviewed as far as potential uses for a safer medical device. The sharps container, there's a picture of it there on the right, where any sharp, not just your needles, but any scalpel or blade or anything would go into this sharps container. It's a red container and it's puncture resistant. Work practice controls include no bending or breaking of sharps, eliminate hand recapping of sharps, prohibit food or smoking in the work areas, minimize splashing or spills, and using good hand hygiene. This would be washing up after a procedure, after glove removal, after any handling of blood or body fluids. PPE examples include gloves, masks, aprons, smocks, gowns, face shields, safety glasses, and for the administration of CPR pocket masks. The employer does have a responsibility to perform what we call a hazard assessment. This is an assessment that determines what types of PPE should be worn during what tasks. Identify and provide the appropriate PPE to employees at no cost, train employees on the use and care, and then maintain and replace any PPE, review and update, evaluate the PPE program, and this can be done as part of the exposure control plan. PPE selection should be safe, the safe design and construction, it should fit properly. Required training would be when is the PPE required to be worn, the types of PPE, how to don it and adjust it and wear it, any limitations of it, and then how to maintain and care for it, and of course disposal of it. The employee's responsibility is to attend training, properly wear the PPE, care for it, clean, and then notify the employer when any repair or replacement is needed. Housekeeping, there needs to be a written schedule for cleaning and decontamination. This should be part of your exposure control plan. Also, there should be a notation about picking up broken glass. This is not allowed to be picked up by the hands. Must use some mechanical means to pick it up. The concern there is that you could get cut and then you'd have an exposure. Mechanical means could be using tongs or brooms, any device like that. So cleanup and decontamination of contaminated equipment and work surfaces. You need to wear protective gloves. Use an appropriate disinfectant. That could be a 1 to 10 bleach solution. It could be an EPA registered disinfectant for HIV and HBV. The procedures suggested are that blood must be cleaned thoroughly before applying the disinfectant. Let the disinfectant sit on the surface for 30 seconds for HIV and 10 minutes for HBV. Wash immediately and thoroughly following a cleanup or decontamination, and of course, properly dispose of any contaminated PPE, towels, rags into a red biohazard bag. Here's a picture of a red biohazard bag. It should be closable, leak-proof. It should have a biohazard label on it. Sharps should be disposed of in a closable, puncture-resistant, leak-proof red container. Contaminated laundry must be bagged or containerized at the location where it was used. There needs to be some kind of label or warning to laboratory or laundry personnel that they need to utilize proper PPE and take extra precautions when handling the laundry. The hepatitis B vaccine should be made available at no cost to employees within 10 days of the initial assignment unless done prior. Refusals can be obtained, but you need to have the employee sign a declination sheet that they have refused it. If they change their mind at any time, you need to administer the vaccine, and boosters can be given as required. Collateral duty employees can be offered the vaccine post-exposure. Those would be employees, say, for example, on your first aid team, CPR teams. Vaccine has to be made available within 24 hours post-exposure. Procedures should be spelled out in your exposure control plan. Training is required for employees annually. You need to retrain if there's a procedure or task modified. And the training needs to be given at an appropriate education level, literacy, and language of the employee. Training must include an opportunity for questions. This may come into play when you are using an online training versus an in-classroom training. So an exposure incident is defined as contact with blood or other potentially infectious materials through the eyes, mouth, mucous membrane, or non-intact skin while performing a work duty. Immediate action should be to wash the exposed area with soap and water, flush the nose, mouth, or skin with water if something has splashed up into those areas. Irrigate the eyes with water, report the exposure incident immediately, and seek treatment with a healthcare professional. Post-exposure follow-up procedures must be given to employees at no cost. Documentation of the incident must be maintained. Testing of the source individual if it's feasible to obtain that. Employees' blood shall be collected as soon as possible after an exposure. Testing for HBV and HIV if the employee consents. And if they don't consent, the blood may be preserved for up to 90 days for testing later. This here is the OSHA, a link to the OSHA website, which has a Bloodborne Pathogens page. There's a lot of really good, useful resources on that page. Other groups such as the CDC and NIOSH have documents on that page. There's also there an OSHA fact sheet on bloodborne pathogens and the standard and what's required, and that is also very useful. So a little bit about the Pennsylvania OSHA Consultation Program. We provide on-site consultation services to small and medium-sized businesses. Small, medium-sized can be less than 200 employees at a single site or less than 500 corporate-wide. We do give priority assistance to employers in high-hazard industries and also employers involved in high hazardous operations. Large businesses can request, but the request, the scope may be limited. We do not give any citations or penalties. We do ask that the employee agree to correct any serious or imminent hazards identified. If we cannot get verification that the hazards have been corrected, we will refer to OSHA enforcement. This situation is rare. One of the reasons is because the employer does sign up voluntarily, so they are interested in correcting the recommendations that the consultant has provided. It is free of charge. There is no fee for the service. OSHA penalties and litigation costs can be avoided. It reduces workers' compensation costs by reducing injuries and also minimizes equipment damage and production losses, again, as a result of reduced injuries. One consultant identifies an average of 7 serious and other than serious hazards, saving the employer approximately $87,000 in OSHA fines per visit. To contact us, we have a webpage listed there. We have our Facebook account and a Twitter account. We also have our 1-800 number. We are located on campus at Indiana University of Pennsylvania. So thank you for attending today's webinar. Our upcoming webinar is on October 16th at 10:30, and the topic will be temporary workers.